of course, cure is very intriguing to us, and anytime you see it, you're very interested and want to focus in on what they're talking about with cure. But I think the reality is, well, I know the reality is that right now there is no cure. There are some who would be deemed cure, but it's in the medically insignificant category, meaning there are just so few that are having dramatically extended lives after having multiple myeloma. So naturally, I think it's correct that the first stage of getting to cure is controlling multiple myeloma and moving it more into a chronic disease category versus terminal illness. And I think that we're much closer to doing that than the cure, but I think it leads to the cure.
I would agree with Lori. I might fall into that medically insignificant number of people that could be considered cured, in that I had a full allogeneic transplant back in 1998. But I still go every 6 months for blood draws, and I still expect one day my oncologist to tell me it's back, and I know what next treatment I think I would be taking depending on what's approved by the FDA at that time and such. So I think it's all about controlling this disease. I remember my GP who told me 17 years ago when I was diagnosed that the good news was that myeloma was a disease to be managed. It was a while later when I realized he was more lucky than profound, but he certainly set me on the right path to just be educated about this disease and do whatever is necessary to try to control it chronically.
I think it's remarkable, Jack, that 17 years ago, your doctor thought it was a manageable disease. That's, way ahead of some of the doctors that are still presenting a very dismal potential outcome for multiple myeloma. And I would agree that he was probably more lucky than profound. It's tough, at least now we know it can be managed. We know that 85% of all newly diagnosed patients are considered low risk without having high resistant chromosome abnormalities, and that even some of the chromosome abnormalities in the past that were viewed as high risk are no longer viewed as high risk. We have gene expression profiling that's been going on in Arkansas for over a decade and now is beginning to go into trials to be able to get to a point where there's clinical use outside of the big research facilities. And I think those are all really great things so that patients are not wasting their time with treatment that may not, work for them because of other chromosome abnormalities. So you're definitely a myeloma hero. When I meet people that are in excess of 5 years, it's exciting and it's becoming more and more common. And I told my husband early on, I said it may be medically insignificant, but it would be personally significant to us. So we just kept working in that direction.
I think what is interesting is with all of the newer novel therapies out there, like the Revlimids and Velcades and thalidomides that have been approved over the last 8 years, and with a couple of new drugs on the horizon for approval and many more new drugs in clinical trials, that the disease is becoming one that can be managed more easily. So that's the good news. The bad news is there's a lot more treatments out there, and you don't really know which is best for you. While you're right that patients are now analyzed with respect to high-risk factors and gene expression profiles and such, they really are at the very beginning of understanding what treatment might work best for a given patient, and exactly which high-risk factors are most are the best prognosticators and indicators of which treatment to use. So compared to when I was diagnosed, myeloma has really advanced. But in the next 10 years, I'm sure we all agree that it will advance